Good evening. I would like to start by thanking the Bosch alumni for giving me this wonderful opportunity, especially Raphael for inviting me to be on this and sharing our experiences of how we have tried to deal with the COVID pandemic in our work in slums in some of the cities that we've been working in. So having said that, let me quickly introduce the organization. I'm the executive director and founding member of Shelter Associates, which has been working in a few cities of Maharashtra for the last 27 years. We have been working with the objective of trying to see how we can facilitate a better quality of life for the urban poor, largely residing in slums, and who have very poor access to some of the most basic services that you and I are very used to having at home, that is water, sanitation, light, solid waste management, etc. So I would like to show a few slides and we'll share my screen. Okay, I hope all of you can see the screen. So how did we deal with the pandemic? Well, just a few statistics before I start. There are supposedly 1.5 billion people across the globe living in informal settlements that we call slums. And COVID-19 has been spreading really fast globally. But in some of the cities of India and in the state of Maharashtra, it has been on a phenomenal rise. And it has been a matter of grave concern because what we were fearing is what really happened. We somehow wanted to contain it, especially in very high density areas, which are again, the degraded areas of our cities. So slums have been really the hotspots for this virus. And most of us know that because of the densities, because people often have to use community facilities, the moment you step out of your house, you're literally jostling with people to reach the common amenities that you're using. It could be a water stand post, it could be a community toilet. You are always physically coming into contact with a lot of people, even as you're moving in these areas. So social distancing is something that I think is a very tall order, or it's too much to expect even to happen in slums. So how do you help? Of course, our immediate response was, what can we do immediately to give some relief to the people who have been hit by the pandemic? Luckily for us, we've been an extremely data-driven organization. So whenever we worked in any city, we've always started with creating data on slums and creating spatial data. So once you have a good data set, which gives you a very good insight into the condition of the slum vis-a-vis the existing infrastructure, the gaps in the delivery of very essential services, then where you need to start plugging the holes. But here, for the first time, we started using this data to identify the most vulnerable families. It could be families with physically handicapped people, or families where only there are old people living there, or women-headed household, people who are otherwise also even more vulnerable. We decided, let's start by maybe giving them hygiene kits. So we had citywide data created for some of the cities where we'd been working. We were immediately able to leverage that data and identify households from every slum and then reach out to them with hygiene kits. While we were doing that, we realized that there were some pockets where you needed to even extend dry ration. So we started doing even that, giving dry rations, hygiene kits wherever we were going. But then we realized that the more we went into the slums with these relief measures, we started getting people, demanding for home toilets, something that has been one of our core competency areas. All of us know that community toilet blocks are very, very poorly maintained. They're very crowded. You have to queue up, very unhygienic, and really the hotspots for any kind of infection. And if people had to go there during this kind of a pandemic, it really created a lot of fear, especially where children are concerned. You don't want your child to be exposed. You don't want your old people to be exposed to these kind of unhygienic conditions. So while we did do immediate relief work, and some of these slides will show you that, through the GIS mapping, we were able to really target, we reached out to 11,000 individuals with just hygiene kits, and over 20,000 people. We also did something which was very interesting. We created a whole network of volunteers in slums through whom we started spreading messages around the virus, coronavirus, because we found there was so much panic, there was so much of stigmatization that was happening in slum, that it was very difficult, especially for COVID victims, to lead a fairly sort of a safe, normal life, because they were so stigmatized. So we wanted to let people know what it was, how they could extend support to families within their own community if at all there were COVID cases. So we really went around, through telephone calls, empowering volunteers in communities, living in communities, to reach out to the rest of the community. So this was something that we did, and what we call the awareness call. So over 20,000 people we reached out to in this period. And we also got phone calls from families who had availed of a household toilet through our various earlier initiatives, thanking us for having, created this awareness around having a home toilet. So you can see in this slide, there are smiling faces of some of the beneficiaries who were relatively less vulnerable than their peer group who had to go to community toilet. So I would like to say at this point that while there's a lot of relief work that is still going on, we have shifted our focus to going back to, mobilizing communities to take a home toilet. Right now, we don't need to convince people too much, because people are already convinced that this is something that they should be doing. They should have a home toilet. So how did we go about it in the first place? And this is where I feel that, data is of prime importance. It is the only thing that will allow you to very realistically tackle any kind of an emergency on the ground. And we have been doing that for more than 2 decades now. In fact, we have pioneered the use of GIS softwares for mapping poverty as early as in the late 90s. We were the first NGO in the country which started using GIS softwares for mapping poverty. And then as we went along over the years, we started honing our skills. So when Google Earth was launched, we started using Google Earth as our base map, on which we started superimposing all this data. And then, of course, from paper-based collection of data, now we're doing it on applications on smartphones. We've moved to an open source platform. We've actually published data that we've gathered about slums on our website. And several cities have linked their website to our website, to make that data of their city slums become available in the public domain. So it's been a fairly long journey, And we're very happy that, in this journey, we've been able to co-create this data with the communities and with the municipal corporation. As I said, this data has been now put up on our website. So it's a web-based data. Anybody across the globe can use it. And as I said, it is now in the public domain, even more so because the municipal corporation, this is one of the municipal corporation's homepage. And as you can see, Shelter Associates has already, the logo has been put on the homepage so that if you click on it, it connects you to the data of the poor of that city. So now, how did we manage to impact the communities as well as the municipal corporations to not just use the data, but actually make investments? And we did this across several cities. We worked in 7 cities, and in all the cities, the municipal corporation leveraged the data and actually started laying, sewer lines so that more and more families residing in the slums could start, opting for a home toilet and connecting to the main city sewer networks. So if you look at some of the cities that we've put out on the slide, there has been a phenomenal increase in both the networks as well as percentage of people having a home toilet now. And this has all happened in a span of about 5 years. We were lucky that the Swachh Bharat Abhiyan, which was the Government of India's program, was launched in 2014, which gave a major impetus to this one home, one toilet model of ours, and which became, it was like sanitation was really brought center stage. And I think that really helped because cities started taking it more seriously. If you look at the city of Pimpri-Chinchwad, they had a coverage of drainage network, which was barely 37%. It is now up to about 68%. They had only 11% of their poor having access to a household toilet. Today it's up to 57%. So you'll see that, there has been a tremendous amount of swing in some of the cities. And, when the pandemic struck this year, we were very happy that, there were a lot of people who were already very safe, but now we wanted to target people who really now understood and valued, the home toilet, and we still need to reach out to them. So if you look at, say, this is one of the cities, it's called Pimpri-Chinchwad. It's very close to Pune. It's known as the twin city of Pune. If you see all those red blobs that you see on that map, those are all the slums, and they are pretty well spread across. We started doing, gathering data, and if you see, this is one of the slums. It's called Dattanagar, and we had mapped the existing municipal lines. Along with that, then we did site visits with the municipal engineers and tried to see where additional lines could be laid. So a lot of those lines in blue that you see were the new drainage lines that came up. Because of that, all those houses in yellow were able to take a toilet, which is like, say, 814 families in this particular settlement. Finally, which, I think in this settlement, we reached out to almost 65 to 70% of the families with a home toilet. So what happened as a result of it was the community toilet blocks, which were otherwise under tremendous pressure because the toilet to person ratio used to be really, really high. That pressure started easing. So maintenance became easier. So cleanliness was also to some extent observed, and they are slightly better off than what they used to be because most of the families now have a home toilet in this particular settlement. Also, it allowed the municipal corporation to then start phasing out the delivery of a service like this, over a period of time. So when we first got data, when we were able to identify the existing drainage networks, we sort of prioritized those houses along those networks. And the ones who couldn't take a toilet, those were then laid in the subsequent years. So we continued working in the slum for, say, maybe 2 years or 3 years, and eventually tried to see if we could sort of saturate most of this, the community with household toilets. And it allowed the municipal corporation also, to phase out and make budgetary provisions for it. So if you see one of the impacts of one of the slums in Pune city, from barely 2% household toilets, and with a toilet to person ratio, which was like for one seat, there were 226 people using it. Today, it has 71% of coverage, and the toilet seat to family to person ratio has dropped down to 1:54. Data also brings in a lot of transparency, and this is where I think it's great if you can, use data to even win over the confidence of the donors. So every donor, whoever has sponsored, a home toilet, we've been able to share, via a link, the exact house that has received a toilet with their support, with a little bit of the family background, as well as a photograph of the toilet. So this has really helped build a lot of confidence in the project. Also, what data then does is it starts really helping you to identify which are the hotspots within your, within your communities. It need not be only always a community toilet block. It could be even open spaces around, or it can even give you, it can also give you an option of converting an existing community toilet block into an area resource center, because you'll find in many communities, people hardly have a place that they can call their own, where they can congregate, where they can do group or shared activities. And so wherever in slums we've been able to really, saturate the slum with household toilets, the existing community toilet blocks, we've proposed that they be demolished and area resource centers be created. So these are proposals that we've given to the municipal corporation. And also what we have tried doing in some settlements is that wherever there were dumping spaces, which became a major challenge because they were so unclean, we tried to get those cleaned out. We've also done tree plantation. We've tried to create spaces where children then can use it. So it becomes a usable open space. And it's very, very welcome, to the communities who otherwise the children have nowhere to go or play. So this kind of intense mobilization of communities, using them to gather data, using them to make, to plan out this, how they would like to see their slum in a few months or a few years down the line. Really getting their inputs, I think, has really helped us. And similarly, we are now working in a few slums in 4 cities, and we've purposely chosen COVID hit slums so that we can work in these settlements and actually reach a home toilet wherever there have been, families with COVID patient. So Lakshmi Nagar is one of the slums where we have started this activity, and in the last month or so, we've prioritized a home toilet, and there's this huge demand that needs to be met, and we've already started. So can you see those houses in pink? Those are the ones who already received material. There are about 81 families to date who have received material, and of course it's an ongoing process, of which almost 50% of the families have finished constructing their toilet. At this point, I want to say that it's a cost-sharing model. It is not something that is being doled out to them free. The only thing that they get free at their doorstep is the material that they use, that they need for construction. But the cost of construction is entirely borne by the family, and they then construct it, monitor that construction, invest in a lot of finishes. You'll find that in every toilet, people have really gone all out, bought tiles which they like, so they've really made it very nice. It's a nice place within the house, even in that tiny house. And I want to say at this point, because this is a question that gets thrown at me wherever I go, how do people ever build a toilet at home when they're already living in such tiny houses? And this is where I want to tell you that even in 100 square feet house, people have prioritized a toilet, and 100 square feet for the global audience is like 3 meters by 3 meters. But even then, people have taken a tiny toilet because you cannot underestimate the need for access to safe sanitation. And so this is the way we are trying to help, and do our bit in the current pandemic. I also want to say that we've also been working on housing quite a bit in the past, and we've also maintained that when you design housing, you have to really put the human well-being at the center of it. If you're going to just go in for a kind of a approach where the existing house is going to be incrementally sort of improved, I mean, that could be one of the approaches, but it's not a very effective approach when it comes to a person's well-being. Because typically in slums, you have in every house, they share typically 3 walls with their neighbors. There's only one wall, which is normally the very narrow one, which is an external wall through which they get all their light and ventilation, which is absolutely inadequate. Often, these houses are off extremely narrow lanes. So as it is, there is very little light and ventilation reaching you. And then when you're hemmed in on all 3 sides, it certainly is not something that is going to help anybody in terms of well-being, physical well-being, mental well-being. And even if you have managed to give everybody a more permanent house by, changing it from impermanent material to a permanent material house or structure, when you actually look at it on a satellite image, it's not going to show any difference. But if you look at this particular image, this is a slum in a city called Sangli Miraj Kopad Municipal Corporation. And we did an entire redevelopment of the slum. This is the before and that is the after. And if you look at the before and after now, you can see that, I mean, nobody would believe that this was a slum once upon a time. We have redeveloped it, taken it to a slightly higher, mid-rise kind of a development. Every house has ample light and ventilation. You're not running into each other. There's enough of a corridor space. So when a pandemic like this strikes you, you want people to be less vulnerable, isn't it? And if you can promote housing which works in terms of, well-being, I think that needs to be really prioritized. And so again, we've used data very, very intensively to do these projects wherever we've done housing. But one of the problems that we've noticed and which has got really amplified by this pandemic is how do you reach a particular household which has been hit by the pandemic? If you have a COVID patient in a slum, which probably houses thousands of families, and all they have is just one address, which is the name of the slum. How do you go and, reach that particular house very accurately? And that is what is necessary and the need of the hour, that you should have data which can allow you to navigate to each and every house in the slum so that you can reach them not just with services like water, sanitation, electricity, whatever it may be, but in a crisis, in a moment of crisis, when you need to get an ambulance, you need something to come to your or get a fire engine or whatever. You should be able to put out an address on Google Map, and you should be able to allow people to reach you as close to your house as possible. And this is where we are now heading towards, giving every house an address, which is alphanumerical, which is generated based on the lat-long position of that house, and which can be ingested in Google Map. So if you put out that address, you can just navigate straight to that house. We have already done a couple of pilots using this kind of app, which has been developed by Google, and it's called the Plus Code. And we find that it can be very, very effective, because even people in community, I mean, the thing that they need almost every other month is a cooking LPG cylinder. And often people have to wait at the edge of their settlement or at some kind of a landmark where it is delivered, and then they have to lug it to their homes, which can sometimes be really in the interior of the slum. So it's quite a task to get anything delivered to your doorstep, and which is why we want, this kind of information to be made available. This kind of information should be integrated with the government's platform, data platform, and it should be used very extensively. So this is the next, data challenge that we're moving towards. And the whole idea is that we need to, sort of integrate this with the urban local bodies data platform. So, I mean, look, if you look at this map, we've been able to identify the house in red, which has a COVID patient. And at some point, you need to screen the immediate houses in the vicinity. So you can start creating these kind of, buffer zones to allow a much easier way of, reaching out and dealing with the situation. These kind of maps would be very, very useful for the urban local bodies. I think these are just some of the slides to show how we have been, sort of mobilizing the communities. And when I say mobilizing communities, I mean the entire cross section, right from small children to the youth, to the women, to the men. We really, really get them involved in many, many activities, whether it's around health and hygiene, whether it's around data. It could be anything that is affecting their slum. And use, the mobilization to very, very strongly, effectively communicate whatever is the need of the hour. And because people feel so involved, because, they're so engaged in that entire process, we find that eventually, whenever there is a solution that is put out, it becomes a very sustainable one, because people own the process. And I think that is very, very critical. But I think I would like to now end by saying that one of the pain points that really, really need to be addressed by cities is, how will you institutionalize slum data now in your governance practices? Because if you decide to ignore them, you would be actually ignoring anywhere between 30 to 60% of your city's population who reside in these degraded areas, especially in large cities like Pune, Thane, and Mumbai. You have a large percentage now living in slums, and we all have understood or have awakened, to this, glaring kind of reality that the well-being of every human being matters if you want the city's well-being. So if you cannot if you cannot use data for good governance, we're never ever going to move towards smart cities who can, reach out to their citizens. Today is this pandemic, tomorrow it can be anything. So on this note, I'll end over here, and I'll be very happy to take any kind of questions that you might have for me. So thanks a lot. I look forward to fielding some of the questions from the audience, whoever is on it.